Can you say a little bit more about like why play is so important to support the mental health of your patients and their families and the medical staff as well?
Play is the work of children. Play is really
A universal language.
It is. It's a universal language, and we need play. We need that for any support that we're going to provide a pediatric patient so that we can, again, figure out that best course of intervention for us moving forward.
And I can recall a little anecdote about a patient that I saw in the ED, and she was terrified, just inconsolably crying for all of the things she was brought into this new place. Her fingers hurt. She doesn't have her family with her. All of these things were the storm brewing, and the only thing she could do was cry, and she was having trouble expressing herself. First, I just brought some things in, some developmentally appropriate play. So we did some stickers. We had some Play-Doh. I brought her a stuffed animal for comfort. And we just started playing, and she immediately wanted to play, which tells us so much about children. In the midst of crises, in the midst of being sick or being hurt, they still have that want to play and to make sense of the world around them by doing that. Just like Rita said, that play is that language, the work of children. And as she de-escalated, I talked to her. I said, I noticed that you're pretty upset. You are crying. What is it that's making you upset? And she was able to verbalize those things with me. So I'm already making progress. I knew that I was going to have to prep her for the scary part, which is removing the gauze. She didn't want anybody touching her hand. So did a lot of reassurance through play. Since I had built that rapport, I had told her, my friends, I always establish the medical team as friends. They will be so gentle. Well, what do you want them to know? What should I tell them for you? Being a representative for her, all while doing play and making this a normal and comfortable environment for her. What we needed to do, and the medical team was able to do and complete that procedure because of play and because of that rapport building that play allows us to do. And I was so thankful to see Child Life and Play and the medical team all come together and work together to provide the care that little girl really needed.
That is such an amazing example. And I know I have a background in child life. I was a child life specialist for many years in Iowa. And I know that that example isn't just a rare case. That's something that happens throughout the day by child life specialists. And they do that over and over throughout the day, jumping from patient to patient. And what we also know is that there's clinical research to show that these interventions aren't just play as fun, but they actually improve the outcomes for the patients. They reduce procedure times, and then it makes the environment so much better for the rest of the medical staff to be able to do what they need to do, that it just overall improves the entire experience for patients, families, and the medical professionals all together. So thank you so much for sharing that as an exemplar, and just to know that it's just scratching the surface of some of the play interventions that you provide. Um, since the children do experience these challenges in coming into the hospital, and some, may have normal development or appropriate development outside of the hospital, but a lot of them are also there's this surge of children with mental health challenges. Can you talk a little bit about how that has impacted your patient care?
I think we have noticed here at Miller Children's, even before COVID hit, that we were already seeing an increase in the number of pediatric patients that were coming to our emergency department. Many times that would be their entry point for us, and it usually is through the ER. And we were seeing more and more children with behavioral health challenges, sensory issues, and so forth, and autism spectrum disorder. But once COVID hit, we kind of had less pediatric patients around at the beginning. And then now we've had, of course, this huge resurgence in the numbers of children and very young pediatric patients sometimes with behavioral health issues coming to our emergency room has just skyrocketed. Bringing in the sensory piece, I think, is so important because whether it's a behavioral health issue, whether it's ASD, autism spectrum, or just in general some type of sensory issues, right? Sensory sensitivities. The emergency department, the hospital as a whole, but especially the emergency department, just exacerbates all of that because it's so fast paced, so many things happening, loud, all of that. So we're not setting them up for great success just while they enter the emergency room, right? So being able to provide some support for this increase in number that we're seeing of pediatric patients has been amazing. We've ordered all of our stuff almost for our new sensory program that we're starting to put together to provide through the Toy Foundation grant for our pediatric patients.
By equipping our staff, our whole ED staff, all of the medical team on different units with tools like sensory items, like fidget items, like play that's appropriate for these populations. Not only does it help our patients and families first and foremost, but it really empowers our staff to say, I can help these patients and there's more that I can do for them. And that makes a world of difference and can be really powerful.
I know I can speak on behalf of the toy industry in that we are just, honored to be considered as something that is helping these children in those situations. And we are always striving to do better and to meet the ever-changing needs of children today.